Okay, this is our educational webinar number 39 since we launched in July of 2021. And we've covered a lot of territory between then and now. And today we're focused on in-home care for yourself or a loved one, what you need to know about that. We have Jared Kelso, who's the owner and CEO of Friends for Life, which has served seniors in the Denver metro area for over 25 years. Jared's passion is to support Denver's seniors on their journey to age with grace and dignity. And the long history of success for Friends for Life is attributed to its team-based approach to providing high-end, customized care for each client. Caregivers are all experienced in providing care with duty, dignity, and discretion. And Joyce is the owner of Assisting Hands of Littleton. She has over 10 years of experience in owning and running a healthcare practice and over 20 years of experience in human resource leadership positions. Professional experience gives her the understanding that employees are at the heart of a company and crucial for quality client care. It's through her personal experience with her aging parents, we see that a lot, by the way, that caused her to recognize the value of trusted home care of a loved one, which is why she's very selective in hiring caregivers who are exceptionally compassionate and service-oriented. So we're here to serve all aging Coloradans and the caregivers of today and tomorrow. We are a 501c3 nonprofit organization. We launched in July of 2021, and here we are today. Our mission is simply to connect older Coloradans and their families with products, services, and information that help older Coloradans live their best lives. And why are we doing this? Well, because our population's getting older. That's the bottom line. So last year, for the first time, we had more people over 60 in Colorado than under the age of 18. This is a trend that has no end in sight. And we focus on two groups. Those of you who are on the call today are in one or the other of these, or maybe in some cases both. You are a caregiver for an older adult, or you are an older adult who may or may not yet need some care. And care comes in a variety of packages in different ways. And we're here to provide access to all of those. As it says here, there are 3 million Coloradans over the age of 40. So that's our audience, about 3 million people. And this is just a quick shot from our website to show this is our homepage. We'd encourage all of you, if you haven't been to our homepage or our website yet, please go and check it out. We always appreciate your feedback. And then, as it says here, this is the last one. 63 webinars or recordings are posted on our website, including several in Spanish, about 18 actually. On December 5th is our next webinar, which is focused on how AI is improving healthcare and saving lives in the UC health system. And then you can see a few examples of some of the ones we've already done. So with that, I am going to turn this over to Jared to talk about Friends for Life. Jared.
So I'm the CEO and owner of Friends for Life. We've been doing business in Denver since the late 90s, so a little over 25 years of providing care for seniors in their home and in facility. I'm actually the second owner. I took it over from a lovely lady who started it in the late 90s caring for her mom. Prior to COVID, we started talking and then took it over, and it's just been a real delight to serve seniors in this capacity. Prior to having Friends for Life, I was a certified respiratory therapist a number of years ago, working with seniors primarily with chronic lung disease, and that's kind of where I first got my interest and passion in working with the elderly. And it was in a small town in Georgia, actually, and then I took a little bit different track, went into accounting and small business management, and but just over the years, just really wanted to get back to being in my local community and serving in a way that I could be passionate about. And then I met the former owner of Friends for Life and the founder, and kind of one thing led to another, and the next thing I knew, I was running a senior care company. So And we serve seniors both in the Denver metro, as well as down in Colorado Springs. About half of our um clientele are in home, and then the other half are in facility where we have some partnerships. Primarily, it's just word of mouth is how we um, acquire new opportunities to serve seniors. And our caregivers that we have, our companions, have been with us on average about 5 years or more. Um, and we've just it's been a lot of fun just building a relationship with them and seeing just the joy that they bring to seniors. So um, just really quickly, and I know our this webinar is focused on home care and kind of practical tips for how to find the best home care for our loved ones. So just it's intuitive, but as most people can probably guess, that the more companionship and interactivity and engagement you have during the day with someone who's starting to decline, either mentally or physically, um, the more engagement you have, just really rapidly slows down that aging process. We can't stop it, obviously, but we can slow it down. And just really with the goal of giving more time for our loved ones to spend with their friends and family, to pass along those family stories, that legacy, and their values to the next generation. So our goal is obviously to get in and really slow down that aging process and enhance the quality of life as we age. Um, so qualities to look for in home care, and these are kind of our mission and vision statements, and I'm sure Janice will probably reiterate the same with assisting hands with her company. But just some kind of practical tips I thought I'd bring to the table when you're out there looking for home care. You want to look for a home care system that really becomes an integral part of the support network between the senior and their families. Um, and so that means having their ears and eyes on the senior, seeing what's going on during the day. We at Friends for Life we use a process called their shift reports that our caregivers send in at the end of each shift. These shift reports detail everything that happened on the shift. And then we also ask for our caregivers to also input in their shift report just one moment of joy that they had in their day with their senior. So whether that's taking a walk around the block, or playing, having a, playing, putting together a puzzle, or going out in the backyard and just enjoying the sunshine, whatever it is that brought either them joy as a caregiver or their senior client. We ask them to just document, one or two sentences about what brought them joy that day, and that's a really nice. We've gotten a lot of good feedback in terms from families in terms of that. Just really gives a really nice window into what went on during the day. Clear communication. So that means being available for you know, 24/7 for calls to come in, either from family or the senior, if something's needed. We really desire to be a one-stop shop for really any needs, even though we're non-medical. We still have quite a number of embedded partnerships that we've built up over the years, providing service in Denver to care managers, to facilities, to medical personnel, hospice care. That we are usually we're kind of a bit of a traffic cop sometimes is what we play. Um, and then just working hand in hand with the family and the client to really make sure, we're doing everything we can to the expectations that were laid out by the family. So those are some key qualities to look for when you're considering home care. Um, and then what to look for in the companion. So this is the person that's going to be spending um, anywhere from a few hours to around the clock with the senior. So, what should you be looking for in a companion? One, you just really want to look for somebody who's going to engage them, has a good personality, but also flexible and adaptable. So, everybody's got a different personality, and some of our clients will specifically state, "Hey, I really want to be taken out on outings, and I really want to be engaged in conversation." um, and I want to watch movies together and those kinds of things. And we have other clients who are just, I was always an introvert all my life, and that hasn't changed as I've gotten older. So I just want you to be there to just be, my companion, and I'll let you know when I'm ready to talk. And so we look for companions. We first of all do an assessment with the client, see what their personality is, what they need, work with the family as well if they're involved, and then we really strive to be very careful in terms of making that match with between the companion and the senior. And then we really look for companions who are good communicators, meaning they're going to advocate on behalf of their client, not only to the family, but also make sure they're timely communicating with Friends for Life and my office team. Um, and then looking for caregivers who are very diverse in their backgrounds and skill sets, who can address all of the aspects of their client, mentally, physically, and emotionally. Um, and then the last thing I wanted to just touch on is we get a lot of requests at Friends for Life over the years for once we build a relationship for helping seniors, particularly the ones who may have had they're no longer able to drive for all the obvious reasons, or maybe don't have family and friends that are close to them who can help them get around town. So just another thing that we do at Friends for Life quite a bit is what's called the post procedure care and transportation services. We have a lot of relationships with some of the discharge facilities around town, and plastic surgery and other hospitals where we do a lot of kind of one-off ad hoc transportations to an appointment, sit in the lobby, waiting on the surgery or the procedure to end, and then we bring our client back home to their house, and we'll stay with them as long as they need, anywhere up to 48 hours, to just make sure that things are going well after the surgery. And so finally, just a quick testimonial about the benefits of home care. So this lady just was really reiterating that Friends for Life has been the eyes and ears of her family and herself, um, as her mom moved through the stages of aging into Alzheimer's, and then taking away things like the car, and ultimately moving in a facility. It was just this just kind of captures the full continuum of the services we've provided in Denver for our seniors. And, typically probably 90% of our clients, we start out with just a few hours a week, visitations or taking them on outings to, they always, as we build that relationship and we age, we walk through that aging journey with them, into end of life. That's really our goal, is to be there for that continuum throughout the whole aging journey. So yeah, thank you, Bob. Barbara, those are my remarks, and I'll open myself up to any questions or.
Does anybody on the call have any questions of Jared? I have several questions, but I'm going to wait and ask those after Joyce's presentation. So, okay. So Joyce, you may begin.
So thank you, Bob. You already shared about me. I will skip my own introduction. I didn't put a slide in there about Assisting Hands. Assisting Hands is a franchise. It started almost 20 years ago in Nampa, Idaho. It was actually farmers and a dentist that needed help for their own family members and started their own agency. They weren't doing very well, and they connected with someone who was out of Arizona and made it very successful and decided they were ready to franchise. It's been great to be part of their team, super supportive, and lots of wonderful resources. So it's been a great experience. Our agencies within the Denver area right now, we cover my areas, Lakewood, Littleton, Highlands Ranch. We also cover out to Lone Tree, Parker, Castle Rock. We have another agency that covers Greenwood Village, Centennial, Denver, Aurora, and then up north in Broomfield, Thornton, Boulder area. So those are kind of the areas that we cover right now. And I looked just this morning to see who else is interested in joining our franchise, and it looks like we have some people interested in Denver and the Parker areas. So that's pretty exciting to be bringing on more agencies within our community. As Bob said at the beginning, or I think it was before we actually started the official recorded part, many of us get started because of our own family situations. This is my mom. It took me about 10 years after my dad passed to get her to move here to Colorado. And she was downsizing from about a 5,000 square foot house to 2,000 square feet and didn't really want to get rid of very much. So I built lots and lots and lots and filled the whole basement with shelves, and then found her a caregiver online. Whether you're 7 or 17 or 78, ADHD can really be a problem. And I didn't know how she was going to make it through the move and unpacking and organizing. It's been about 4 years now. She still works with her caregiver that I had found her. I can't hire her privately. She charges more than I bill my own clients. But she's been great to work with and still helps just keep my mom organized so that she feels calm and at peace herself. Fortunately, I'm lucky she's still very independent. We provide solution-based services to enhance the quality of life of our clients and support and provide peace of mind to their loved ones. Being solutions-based, I like to make sure that I'm familiar with the other services, agencies, organizations within the community, which is why I was super excited to find to become part of AgeWise. We work with organizations that loan expensive durable equipment for free. We make recommendations for them. We work with healthcare providers, many of you that are on here that are mobile or support seniors specifically, supporting activities that they do in and out of their homes. And then providing the support services and recommendations for people that they can reach out to. Again, we've worked with many of you that are part of this AgeWise community that provide that care management or support for dementia caregivers, things like that. And then the retail support stores that we have within the community. We have some great ones with products and things within Lakewood, Littleton areas for sure. The different kinds of clients that we serve: seniors that are in need of personal care assistance, clients that have dementia or memory issues, individuals with chronic conditions, elderly that are just seeking enhanced quality of care, and then disabled individuals, including veterans. We do work with the VA and are able to take on veteran clients. We do not accept and work with Medicaid paying clients at this time. The enhanced quality of life is super important for all the clients, and some it's just the companionship. As Jared had mentioned, having that connection to other people. We have a client that, because of dementia and her family having to find her when she get lost driving, they've taken her car away from her, and we just drive her into the mountains. They go to Tiny Town, or they go to Evergreen, or when the weather's not so great, they drive to Southwest Plaza Mall and they people watch for a bit. So those are really important. And our outcomes that we work to achieve are enhanced quality of life, improved nutrition and health, decreased hospitalization admissions, consistent delivery of care, increased communication, confidence in care, and peace of mind. Having worked with many clients, there's lots of frozen meals, lots of lean cuisines or Stouffer's meals that are so high in sodium and just really not that healthy. So once we have our caregivers that are going into the homes, we're able to provide those more nutritious, fresh meals, which is great. Also on the health side, being able to communicate with the families closely through having live real-time communication available for the clients and their families. Sometimes our caregivers, we train them that if they notice the client is not feeling great, acting differently, moving differently. We have so many clients that have urinary tract infections, UTIs. So we kind of work with our caregivers as we're training them to kind of be on the lookout for that. And then we are able to not diagnose, but suggest maybe they have their loved one looked at. And that prevents a lot of hospital stays for sure, along with, providing safety from fall risk. How we begin our journey with solutions supported services. We ask what their greatest pain point is for both the client and the family members. What's the situation they're in, and where is their help needed? We help, as I said, with cooking and nutrition, with driving and transportation, whether that's to the doctor, to run errands to get the groceries or to pick up prescriptions. If they have confusion or forget whether they've taken their medications or not, or making sure the family's able to see the care notes and confirm that the medications have been taken. Helping with fall risks and making sure that their environment safe, that there aren't tripping hazards in the way, they haven't left things on the ground, things like that. We also want to make sure that the family is fully aware of what's happening day to day if they're not with their client loved one who either lives separately from them or will they're away at work all day. So they're able to get into our system and see what happened, what was done. I love Jared's idea of one moment of joy. Sorry, Jared, I might steal that one. That's a great thing for the families to be able to see and really feel good about what their loved one is receiving in care. And then identifying if help is needed. When it's time to go out and seek for help, when there's difficulties with clients completing their personal or household tasks, they're not keeping up with their personal care, their hygiene, or whatever chores need to be done around the home. With that family caregiver who is maybe a spouse or a child of those of us that are in that sandwich section, needing some time away and having support there for us because of burnout or tired, fatigue, exhaustion, or just needing to be able to get our own projects or interests done. Stamina issues. We have clients where the spouse can't help anymore and the primary spouse doesn't want to do all the meals or all the housekeeping anymore. And so we're able to come in and provide some of that. Loneliness, depression, anxiety, having that, constant communication and care that they receive, whether that's checking in with them once or twice a week or checking in with them every day of the week to make sure that they're getting all of their needs met. And then with that, the lack of mobility, activity, or daily connections, as I mentioned, with other people. Sometimes our clients just sit in their bed or they sit in a chair and they don't get around very much. So with having a caregiver there, we have the opportunity to help them move a little bit more, get up and walk around the house, or feel comfortable to go on a walk down the sidewalk for a little bit, things like that. Sometimes helping with those everyday things that we take for granted since we're on technology, working with their computers or wanting to do online shopping or helping with an issue with their utility bills, different things. So those are the kinds of things that we look for and we work with the families to help support. And then this kind of goes into the different ADLs that we just talked about and I kind of just spoke of as we were going. So helping with the safety, with morning and evening routines, that respite care, helping with monitoring chronic disease progression and improvement in those areas also with extra support provided by our caregivers. How we can support family caregivers. We want to encourage them to take care of themselves. What I found with getting into this industry, I am a mom, and I feel like we absolutely come into this world and leave this world exactly the same. So many of our in-home caregivers for our clients, they're exhausted, they're fatigued, they're like new moms who forget to take care of themselves, forget to meet their own needs also. So by us helping them focus on having downtime, taking care of their own mental and physical health, getting them the support they need with an extra hand, and providing the peace of mind that they know that there's support and solutions in place for them. The respite care that they receive is, possibly just letting them get out of the house or provide time for them to do their own hobbies or interests, or allowing them to take a nap or sleep well at night and knowing that their loved one is being taken care of. And it's so important to always acknowledge to our primary home caregiver, meaning the family member, that it's okay to ask for help and that it's okay to have time off and to take care of themselves for sure. What makes our agency Assisting Hands special are some of our foundational principles. Collaboration. We believe we are better together. We collaborate with the client and their families to achieve their desired goals, with healthcare professionals to achieve better health outcomes, and with the community to create greater impact. Being part of this group, learning more about the different services that you all provide and how we can recommend and encourage our clients to look into those. Transparent communication. We lead with integrity and honesty to provide transparent communication, set and meet expectations, and instill trust and confidence in the process. We have a online system that we use, so it's real time. Our clients and their families can always get into it. It allows them to see exactly what's happening, along with getting regular communication from our office and our team and our staff. Operational excellence. We solve, not just serve. To serve our clients and each other, we go beyond mere tasks and completion, and we approach challenges with solution-based mindset, turning obstacles into opportunities for growth and improvement. We also believe in consistent reliability. We're committed to the consistent delivery of services and provide a structured approach to meeting the needs of each individual's unique care based on professional solutions we deliver with confidence. One of the things within my agency is I don't hire anyone into my team that works in the office who isn't willing to go out and provide care if needed. We have sometimes caregivers call out, or a new client that's coming on, or different reasons that a shift isn't covered, and we will go out from one of our office staff and fill in if needed on those shifts, so that we're able to provide that consistent care for all of our clients. And then we have a strong team focused approach. We equip and empower our team with tools, training, and supportive accountability to deliver competent care with the confidence, with providing opportunities for growth and leadership development. So we work with our care team that they come in as caregivers. They can move up into care leads. They can move up into care managers, and then into the office team if they're interested in that. So we want to make sure that we're creating that great team environment for people to have the opportunity to develop themselves, because whether we're young or we're old, people want to have a purpose and they want to feel like there's growth and development in their world for them. We definitely proactively engage extra support. We offer to ensure our clients and their families are getting the correct and best care. We focus on maintaining independence, supporting that safety and health, personalized support through our specific tailored care plans that are all done online. And then we only employ W-2 employees who are fully background checked. They're all insured and bonded. They're trained through our office. We train on all kinds of things, including fall prevention, dementia, and chronic conditions. Providing smooth life transitions as people are coming to and from the hospital, whether we're there just to help with that post-hospital surgery, or if they're a client that have been with us before they left for the hospital, and helping them transition back into their home after leaving the hospital or rehab. Having ongoing oversight. So we have a multidisciplinary staff, and then having that strong communication with that real-time opportunity to look at care notes and ADLs and things like that. And I think that is all that I have. Are there any more questions or anything that anyone would like to ask, or leave it up to Bob as he's ready to ask some questions?
Thank you so much, Joyce. And you saw, I would ask Joyce and Jared both to put your contact info into the chat in case people want to get in touch with you. Yeah, questions. So I've noticed a few questions pop into the chat during both of your presentations, and neither of you folks provide medical, what's called medical, but can you talk about where is the line between non-medical and medical, and can either of you address that?
So we can provide services that people would take care of themselves that aren't specialized. So if they need their medications provided to them, then we would have to work with the nurse, family members, and find creative ways to do that. If they have feeding tubes or GI situations that are more skilled, those are things, again, we work with the family or the client to creatively meet those needs. We can't prescribe we can't provide medications. We can't provide specialized wound care, things like that.
Okay. Do you have anything to add to that, Jared?
No, that's a good that's a good summary, Joyce. Things like yeah, definitely the medication reminders is one we get quite a bit in terms of requests from clients. Um, some clients have, medication dispensers that go off, very sophisticated and go off every, however they need for that interval. And it drops the pill in a little dispenser, and then we can, physically take that, set of pills that were dropped in the dispenser and place it in front of the client. But as Joyce said, we can't physically give that to them. We can also do, I think both Joyce and I, our businesses can do things like, cleaning, say, if the catheter has been pulled out and pushed aside, we can, do that kind of cleaning. We can do for our female clients, perineal care, and those kinds of things. But yeah, so we basically can do everything up until the point where you're physically giving medication or injections to a client that requires a prescription or other certification. So.
And can your caregivers assist with bathing or toileting?
Yeah, absolutely. That's probably one of the main. Imagine that's one of the main things we do. Joyce, you probably would say the same.
Yeah, all personal hygiene needs. So bathing, dressing, teeth brushing, helping with toileting.
Okay. I noticed there was another question about the tax deductibility of, you're both private pay, don't take Medicaid, and just for the record, very, very, very few take Medicaid, because the Medicaid reimbursement rates are actually very low. So it doesn't encourage that kind of care. And so the only thing that could be tax deductible would be if it was some kind of medical care, and so that's not possible. The other thing I noticed in one of the chat messages was addressing the idea of long-term care insurance. So if you have long-term care insurance, as I understand it, it will pay for the services that Joyce and Jarrett provide. If you're my age, you probably can't get long-term care insurance anymore. But so for those of you who are younger, it's something to really take a strong look at, because it could help you much later.
Mentioning with long-term care insurance, we do work with long-term care insurance. You have to qualify for it. So just because you have it and you get older doesn't mean that the insurance company is just going to allow you to have it. So there's specific qualifying activities of daily living, or ADLs, that are required. You have to meet 2 for insurance to be able to kick in and allow it to
good point.
be covered.
And you kind of touched on this, but I wanted to make it more clear. What role do you typically see family members engage in for their older adult family members? What level of engagement do you typically see? I know you can see very high engagement or very low, but what's typical?
Yeah, so with our typically, like you said, Bob, there's kind of a wide range of family involvement, and we kind of leave it up to the family. We follow the family's lead. If we're stepping into, say, a respite situation where the daughter's been caring for her mom for about a year now, she's just wiped out and exhausted. They're just asking us to come in for a couple weeks to provide respite care so the daughter can go away or just have some time to run errands, that kind of thing. Then we're in more of a just very highly communicative role, because clearly the daughter wants a break. And they don't want to be tied down with caring for their mom for that couple weeks. And so we just shift into, we have our care managers who are out in the field, just doing periodic visits with the caregiver who's with the mom, and then just being very communicative with the daughter. Then we have other family members who living in the house. They're side by side with their caregiver, and they're but really, Bob, it really starts with kind of that day one in-home assessment when we onboard a client, or we sit down with the family member or whoever is responsible for making those decisions about the senior that we've been engaged to serve, and going through kind of a detailed list of questions in terms of how they want us to behave and interact with their loved one. Um, because that in-home assessment then becomes critical to the foundation for our care plan and how we instruct our caregivers to interact. Joyce, I guess anything different or to add to that?
No, with Bob's question, I was just thinking there really isn't a typical. We have families that are fully involved and want to know everything, all the way to families that just want to not have to be involved, and that's why we're there. And then everything in between. So I wouldn't say I haven't experienced a typical type of family involvement. Every family is unique, and how they want to be engaged or what it matters to them is part of that.
Yeah, I think that's a good answer. There is no such thing as typical. Nor is there such a thing as a typical family, period. So, you both mentioned screening caregivers, so your background checks and interviews, talking to other people that may have used them in the past. Is there anything that stands out in your mind as being the most important in doing that screening process?
Sure. I would say that they're in it for the right reasons. There's lots of jobs. People can get a job in anything. So making sure they're in it because they really want to help support and care for people. I always say my ideal caregiver is someone who has facility experience, because they get a lot of experience in a lot of different areas, but they don't like the culture, or they want that independent individual family home setting, or even if they're in a facility, they're still working one-on-one. But finding people and having people who really want to care for others. And we don't have a hard time finding that, because most people who come into caregiving in an agency setting versus a facility are definitely looking for that. And they aren't becoming owners. They've taken care of their moms and dads and grandparents and loved ones, and have found a passion for being a caregiver of the people that they have in their family. So many of them then come to us after their experience is over, to work with us directly, caring for others.
Yeah, it's just a very rewarding opportunity to serve another human being, but it's also very tiring and exhausting. And so you just got to have, as Joyce said, just a real heart for loving on, another human being, and everything that comes with it, the hard stuff, the tiring stuff, but also the joy that it brings, and last, aging journey in the last stages of life. Um, I saw Christy Ziegler had a question I haven't been able to respond to about staffing with Christy at Kavod Senior Living. Yeah, I mean, I guess yes and no in terms of staffing challenges. Obviously, uh, I think everybody in this business has gone through cycles of, um, people, moving to the next agency or opportunity, to just get based on economic reasons. But I think for us, again, a lot of our caregivers have been with us for 5 or more years. We've got several caregivers that work on our 24/7 teams that have been with us for 10 or 15 years. Really the staffing challenges, I think, come more when you're trying to do the shorter shifts, and maybe it's in a hard part of town to reach. Those can be a challenge, but then we try to set expectations up front with our clients and their family that because the shift's going to be a little shorter, and maybe a little more sporadic, or maybe it's distance issues, just need to be patient with us. because we want to make sure we find the right match, and we find you someone that is going to commit to those shorter hours. But I think by and large, we, I feel like we do a pretty good job with our management team in terms of just really um, caring for, knowing all of our caregivers and what kind of makes them tick, and keeping them loyal to our clients.
And I think there's been an evolution with caregivers pre-pandemic, during the pandemic, post-pandemic, and now. So during the pandemic, people were stressed, overwhelmed, overworked, worried, concerned for their own safety, everything else, and that had its own component to it. Afterwards, people were fatigued and not necessarily wanting to be, sometimes getting out of caring for others for a bit. And then after the pandemic, also noticing there was rates had gone up for pay rates for caregivers quite a bit, just because there was a scramble as a lot of seniors did leave the workforce, that the fast food places were paying more, everyone's paying more, so caregiver pay rates go up and everything else. And I noticed the quality of the caregivers for maybe about a year dipped, and the expectations or entitlement seemed inappropriately high. I'm not happy that we're having inflation. I'm not happy with the cost of my food, my electricity, but I feel like it's brought in a different feeling again, as an evolution where our caregivers are coming in happy to have a job, willing to work and work harder. And so I feel like the quality of our caregivers has improved again, as we're all suffering through higher costs of things.
Okay, thank you. I noticed a question about Medicare here, and I would ask each of you, to talk about that. Medicare does cover certain services for certain periods of time, but apparently it some certification. So I noticed, Jared, you had answered part of that question. So do you want to talk about that a little bit, and then I'd ask Joyce to do the same?
Yeah, sure. No, we are in the process of applying to receive certification under to provide care, or what's called Medicaid Part C, that provides supplemental benefits. So that's kind of where we are. We hope to, as with any government run program, it's just takes a while and a lot of patience. So our goal is to be ready to go next summer, and we're intending to go pretty slow, just because we're going to have to learn along the way, obviously, and want to make sure that primarily on the compliance side of things, that we're doing it the right way. So, but our goal is by next summer.
And what exactly does Medicare pay for?
Yeah, so it provides a supplement every month for a certain number of hours. It's very similar if you're familiar with the VA aid and assistance program, for example. That program provides $2,000, up to $2,000 of supplement. Now VA requires a spend down to a certain threshold of net worth, whereas Medicare is just more like an insurance plan that provides, again, supplemental hours. And what we're finding, and talking to others that have been able to provide the care under the program, it brings families and loved ones that might not have otherwise considered home care just because they thought it was too costly, but the supplement enables them to free up other funds they have to kind of layer on top, and then they can kind of build a decent amount of companionship or personal care coverage under the plan.
Okay. Joyce, did you want to talk about that at all?
No, it's new. So fortunately, it's just starting. It hasn't been something that we've been able to tap into or that's been available until now. So we're in the same position that Jared is, just getting started and slowly having identified a couple of the specific insurance companies that have said they'll start paying for home care, but it's very new. So we're all just kind of getting started at the same time.
Well, and I would add, just based on my limited knowledge of all this, is that what I've seen is Medicare and actually Medicaid both are gradually coming to the realization that providing people with in-home care and keeping people in their homes as long as possible is actually a good thing, as opposed to sending people off to nursing homes. So it's been a long time coming, but it's finally arriving. But as Jared said, it's a long and slow process. So okay, do we have any other questions? I've run out of my questions. So anybody else in the audience have a question that you'd like to ask? We have a few minutes left. You can unmute yourself and ask, or type it in the chat, whichever you prefer. Okay. I'm not hearing anyone. Not seeing anyone. Okay. Well, in that case, thank you to Joyce and to Jarrett for being on our webinar here today. And thanks to our audience for joining us. Please check out agewisecolorado.org. And you'll find both of these fine groups, organizations on our website. And we very much appreciate everybody's time. We know everybody's busy. And so these kinds of sessions really help a lot of people. And this is recorded. It will be on our website in the probably by next Monday. We do a small amount of editing, and we have a volunteer editor, so it takes a little bit longer. So, but we'll get it up there, and it will also be translated into Spanish.
Okay.
Okay. So Jared and Joyce, you'll get to hear yourself speak Spanish very fluently in a couple of weeks. Okay. Well, everybody have a great day. We'll see you all again soon. Okay.
Bye-bye.
Bye-bye.
Bye-bye. Thanks for the opportunity.